The president announced earlier in August that Scott Atlas was joining as a pandemic advisor. We know that he meets with the president almost every day. The administration brought him on because earlier this summer, Trump had encouraged his advisors to look for a doctor or some sort of medical advisor with Ivy League or top university credentials who basically would argue what he wanted to hear about how the pandemic was going, that the threat was receding, that the country should reopen, basically take the opposite tack of Dr. Birx and Dr. Fauci, who are two of the top doctors on the task force, and who have said the pandemic is a threat in every part of the country. They've urged partial lockdowns in areas experiencing surges. They've encouraged state mask mandates, and those aren't things the president really wants to hear. So Scott Atlas is more in line with what the president wants to do and wants to hear on the pandemic. So he's said things like kids don't get COVID, which there's no evidence for, and that they don't spread it. He said that schools should reopen no matter what, that college sports should resume. He's also pushing this herd immunity strategy, which basically says that you let the coronavirus spread through most of the population and you protect the most vulnerable populations. So nursing homes, prisons, tightly congregated places. That's impractical because vulnerable people live with healthy people, and the science on coronavirus is still evolving. So there are plenty of young, healthy people who get coronavirus and die or who develop long-term complications. So almost every public health expert we spoke with very much argued against this strategy, saying it was dangerous, and some of the dangers could even be unknown.
Many people in the public health community have watched this with horror. The sort of implicit herd immunity strategy, downplaying asymptomatic testing, now the withdrawal of the 14-day quarantine period for people moving from one part of the country to the other, which might be a red zone or a hot zone. This still sort of inability to get the amounts of PPE we need for our healthcare workers, let alone teachers and others who are going to be in high contact, close contact, high frequency interactions with people. So the herd immunity is the implicit policy of the United States. And I think they realize it's politically toxic, and so they don't want to use the phrase, but if it walks like a duck and quacks like a duck, it is a duck. And this is essentially a herd immunity strategy, and it's entirely risky for many of the reasons you mentioned. One is because we have many more people with underlying conditions in the United States. We also don't have the social safety net or the healthcare infrastructure that many of the Nordic countries have. So we won't even be able to deal with the sort of impact of the deaths and suffering we'd see by a continuation of the White House's strategy. What Dr. Hahn has been doing at the FDA, first with the hydroxychloroquine emergency use authorization, now with the convalescent plasma emergency use authorization, is to do the bidding of the White House based on scanty data about treatments for coronavirus. The danger about the vaccine EUA before phase 3 trial results are out is much more dire, because we give treatments to the sick, and in this case to many people who are hospitalized. Vaccines go to millions of people. We depend on them to be effective, so people don't get the wrong impression about what they should be doing in terms of social distancing and other behavior because they're vaccinated, and we depend on them to be safe. A vaccine is going to be an important long-term way to control the virus, and we need a public confidence in vaccines. Remember, pre-COVID, half of Americans don't get vaccinated against seasonal flu. We've had outbreaks of measles and diphtheria and other childhood diseases because we have pockets of people who have skepticism about vaccines. And Dr. Hahn's sort of willingness to play fast and loose with the data, when vaccine developers, researchers, immunologists, virologists are terrified that they're going to sort of get out ahead of the data again because the president wants something by the end of October, so he can bring it into the election week with him, hoping for victory. But this is 3 strikes for the FDA: hydroxychloroquine, convalescent plasma, and the potential vaccine EUA. Harold Varmus, former NIH director today, and Rajiv Shah, who's head of the Rockefeller Foundation, just said stop listening to the CDC because of their asymptomatic testing language, because of the stuff about quarantines. Now, what are we going to do about the FDA? They're not giving us reliable information about the things we put in our bodies, drugs and vaccines. It's their basic statutory mandate, and they're failing us right now. Dr. Atlas has medical training. He's a neuroradiologist. There are plenty of people who have general medical expertise who have been fine public health and agency leaders in the United States. You don't have to be an infectious disease clinician or an infectious disease epidemiologist to do the right thing, but you should know when you're getting out ahead of your skis. And, Dr. Atlas's comments are so far from the mainstream of thinking in public health and clinical medicine on infectious diseases. It's astounding. He could have engaged experts, tried to figure out what the consensus view was, what we needed to do, and to advise the president in that way. But what he's done instead is to sort of think about what the president wants to hear. We're doing great. We don't need to do more tests. We can open up the economy, open up businesses, open up schools, open up universities, and we can sort of get through the epidemic in that way. And
one more.
Because of his appearances on Fox News, he caught the president and the White House's attention, and that's why he's sitting in the place that he is. Not because he has any specific expertise. He's not edgy. He's not contrarian. He's just simply wrong, foolish, and dangerous.